It's an interesting phenomenon. It's actually your own body's immune system overreacting to environmental triggers that all of us are probably exposed to, but a small percentage of the population, maybe in the 10 to 20% range, for reasons that we don't completely understand today, develop an overactive immune response, which leads to a whole cascade of events causing the release of histamine, which is the biggest player in developing these allergy symptoms, and that leads to the itchy nose, itchy, watery eyes, runny nose, and all those sorts of symptoms. The spring allergies tend to be, in the early spring, it tends to be the tree pollens from mid-March until probably around May. And then May and June tend to be mostly the grass pollens that cause patients problems. And the symptoms are the same for most all allergy sufferers for the most part, and that tends to be runny nose, itchy, watery eyes, nasal congestion, and then those with asthma, it has the potential to make their asthma worse or exacerbate their asthma. We're already seeing early in the spring a fair amount of allergy symptoms and patients suffering from allergies. They had record pollen counts in the southeastern United States earlier this spring, and we're starting to see that in the Midwest also. And it seems to be related to the fact that it's been a very warm spring, so the trees started pollinating earlier and more robustly than we usually see. There's a whole host of treatments now for allergy sufferers. Recently, some of the non-sedating antihistamines have gone over the counter, so for those with very mild allergies, sometimes that can be beneficial. Although most of the patients that we see are refractory, or those sort of medicines don't give them adequate relief, so then we go to more prescription medications that still have better benefit. And then for those that don't get good relief from the medications, we also have the ability to do allergy shots, which is probably the best treatment, but also there is a bit of a time commitment to that. We would encourage patients that are having these symptoms to come in and see us sooner than later, as we can offer these treatments and hopefully make patients feel a whole lot better relatively quickly. They can call our clinic and we're happy to see patients, or call their primary care doctor, and the primary care doctor feels that they would benefit from allergy evaluation. We're happy to see patients that way also.